Hello, my name is Dr. Paula Summerly. Today we'll be talking about war on rats and the diagnosis of bubonic plague. In the case here, we have some objects relating to the outbreak of bubonic plague in Galveston. Here we have a standard microscope from 1915. And you can see here we have some microscope slides. One here in particular is very interesting. This slide here was prepared by Dr. Henry Hartman. Dr. Hartman was a pathologist who worked at the University of Texas Medical Branch in the summer of 1920. And he was the first to diagnose first case of bubonic plague. The first person to die during the outbreak of bubonic plague in Galveston was a 17-year-old man who worked on a grain store on 29th Street and Strand. It was called Davison's Feed Store. He was bitten by an infected flea on his ankle and started to feel increasingly unwell. The next day, he went to the John Seeley Hospital. He had a high fever, he had swollen ankles, swollen glands under his arms and around his neck, and unfortunately he died. Dr. Hartman took some sections of the diseased organs, and we can see here, and they show kind of hemorrhagic cells. And there's an image of a modern photograph. You can see what the cells actually look like. So following the death of the young man, and during the autopsy, the diagnosis of bubonic plague was achieved through inserting a needle into the femoral bubo, which was at the top of the first victim's thigh. And some of the gland juice was aspirated into a syringe, and a drop was smeared onto a clean microscope slide. And the slides were then fixed and stained, like they are here, over an open flame, and then examined for swollen bacilli or bacteria. The remaining juice was diluted with saline solution and injected into a guinea pig. So a day or so later, the injected guinea pig would develop swollen glands, thus confirming the clinical diagnosis of bubonic plague. So after the death of the young man, a few hours later, he was buried in the Lakeview Cemetery at 10 p.m. at night. And you think, why would he be buried in the evening? Well, it was due to fear of news getting out about the outbreak of bubonic plague in Galveston. And so the day after, the Galveston Daily News announced what might be bubonic plague is on the island. The second patient to be diagnosed with bubonic plague was fortunate enough to receive anti-plague serum. After the first case of bubonic plague was diagnosed, Mulford's anti-plague serum was made available by the state of Texas, and so some of the earliest victims received that. Between June and November 1920, 11 cases of plague were treated with anti-plague serum, and of these, 6 died and 5 recovered. In terms of other treatments available, there was Hafkeen's vaccine, and you can see here we have a postage stamp to commemorate Hafkeen and his discovery of a vaccine for bubonic plague. These treatments were not without risk. Some patients died due to anaphylactic shock. So most of the victims of bubonic plague in Galveston did receive anti-plague serum. There was one notable patient who received both anti-plague serum and Hafkeen's vaccine, and that was a UTMB pathologist, Dr. Anna Bowie. She self-injected Hafkeen's vaccine and anti-plague serum and survived. So it was fairly effective, but with the introduction of antibiotics, these vaccines were redundant.